Houston chiropractor, Dr. Gregory Johnson, and today we're going to be going over a very specific issue that a lot of people have from old sports injuries, running, football injuries, basketball, you name it. You can get a sprained ankle. Now, we're taking a look here today on Elvin's ankle, and we see that the right ankle, which is the one he has the most pain in, is significantly larger and swollen than his left ankle is. So what we do to evaluate this is to check his range of motion just by doing a full range of motion in there. Now he does have some little cracking and popping noises in there. That's called crepitus. Now we also check the strength. We'll push against me. Good. Pull up. That's weak. Turn in. That's weak. Turn out. And that's also weak. Now push against my hand. There with your big toe. Now up with the big toe. Yep, that's weak too. And see, this one's not that swollen, so let's test this push. Much stronger. Up, much stronger. Turn in. Much stronger. Turn out. That's also much stronger. Push. Yeah, and then let's have you pull up now. Okay, did this side feel tremendously stronger to you than this side? Yes. So we know that he has a subluxation or misalignment in his right ankle as well. And what I'm doing is adjusting these down in the feet. They're called tarsals and metatarsals. And then right here we're going to do a Talus Adjustment. And we're going to put his arch back in there for him. He's starting to get a fallen arch in here. And he also has trigger point right here in his plantar fascia. Right there. Very tender, isn't it?
Yes.
Yep. And then also, when we're dealing with ankles, you never want to neglect the Tibialis Anterior, which is the muscle that runs along anteriorly here in the front from the knee all the way down the ankle. It's what helps us pull our feet up like this. That was very weak when we got started. And this actually makes your ankle feel better, doesn't it?
Yes.
Yep. So what I'm doing right now is called muscle spindle Golgi tendon apparatus work. We're tricking his Tibialis Anterior into relaxing so that he'll have an easier time of walking. Now, since we always do things bilaterally, we're going to adjust his left ankle, even though he's not having a lot of pain there. Now, I've already adjusted his right toes before we start doing the video, but we also are still going to work on the Tibialis Anterior here on the left side as well. Now, on this type of condition, you would always want to use crushed ice in a freezer baggie directly on the skin for 20 minutes only. Most sports medicine people utilize this for professional athletes, collegiate athletes, Olympic athletes, or weekend warriors. Crushed ice directly on the skin with the freezer baggie, but for 20 minutes only, because after 20 minutes it actually has a reverse physiological effect. So we're going to complete his examination of the lower back and extremity. Tell me if you have any back pain besides the pulling in your hamstring.
No.
Okay, and that feel a little looser down here?
Yes.
Okay, any back pain there?
No.
So you had a negative straight leg raise test and also a negative braggart, so I'm going to push straight down, hold it up. Can you try to hold it up against me? Yeah, this is a psoas muscle test, and that was strong. That was a 5. Now I'm going to push down here and tell me if you have any pain in your hip joint or your pelvis.
Not pain. It feels like it's going to crack.
Okay. And then we're going to move to the right one, which is the problem side, which he occasionally gets some lower back pain here too. Now this one actually is a little bit more limber. Is there any back pain or leg pain there though?
No.
Good. So we bring it down. Is there any back pain or leg pain there?
No.
So he has a negative straight leg raise and braggarts on the right. I'm going to push down, hold up. Excellent. He's got better strength there. Relax this. Now, do you notice how you sometimes get a little jumpy? Everything jumps. He's got a little bit of what we call, now I'm going to push down, tell me if you have any pain in the hip joint here.
Yes.
Yes. Okay, so he's got a positive Fabry-Patrick test on the right side, which indicates an actual hip problem. and that's the hip joint. And I'm going to lift your head up and push down. Is there any pain in your spine anywhere when I do that?
No.
Okay, good. Now, let's have you set up, face that way towards your knee. Okay, now, we're going to check his cervical spine out. I'm going to push down. Tell me if you feel any pain anywhere in your spine. No. Good. And I'm going to turn backwards and right. Is there any pain there? No. And I'm going to go backwards left. Is there any pain there? No. Good. Now, tilt your head to the right. Is there any pain anywhere? No. Does this cause any pain?
Just stretching.
Okay. This is called a shoulder depressor test. Any pain here? No. Okay, good. And then the other one was a maximum foraminal compression test. I'm going to have you turn your head left. And now right. Now see, he's got a much greater range of motion to the right than he does the left. That's pretty evident. Do you feel that?
Yes.
Good. Now, I'm going to do a muscle test on your deltoid. I'm going to push down. You hold it up. Good. Same thing here. Oh, excellent. Now, we're going to pull this out. You resist. Good. That's your biceps. Now we're going to do triceps. Excellent. Great strength in his biceps and triceps and deltoids. Excellent. Good. Now we're going to evaluate his reflexes with the biceps, brachioradialis, and patellar and Achilles reflexes. Just let that hang right there. You go. Good. Relax. Good reflex there. Just relax this in my hand. There you go. Watch these fingers move. Good reflex there. And then also his triceps muscle, which is okay. So far his reflexes are +2. Relax that in my hand. There you go. Better. Triceps normal. Okay. There we go. This is why I never stand in front of patients when I'm doing this one. Okay, let that ankle relax in my hand. Okay, just let it relax there. Good. Same over here. Now, interesting, you notice there's no reflex on that right one compared to the left one. You feel the jump on this one and no jump on that one, or jerk. Ankle jerk, ankle reflex. He's +2 on the left, but on this bad right ankle here, he's got absent reflex. So we have to be thinking lumbar radiculopathy and sacroiliac issues as well as ankle. So let's come over here and lay on your stomach for me next. I have you put your face right down in here and arms down there. Okay, now we're going to do, wow, you can really see from this angle too how wide and swollen this right ankle is. Now I'm pushing in here to see if he has any pitting edema. And he does have a little bit of pitting edema, which could indicate cardiovascular issues as well as, oh, that's really bad right there, as well as kidney problems. Yeah, he's got pitting edema in his ankles, so I would want to refer him out for a cardiology exam. Now, down here, his right leg is shorter by ½ an inch. When I bring it up, it actually stays shorter, but that tightens up in your low back, doesn't it?
Mm-hmm.
Do you feel it tightening in your low back right there?
No.
Not bad? Okay. You saw how it stayed short, though. Is that a little tender right here? Not bad? Okay. And here's L5. There's L4, L3. That one's tender. Now you can see that he has an increased kyphosis in here, which is a backward C-curve in the thoracic spine. Normally it is a kyphotic curve, but he's got too much of it. And his lumbar curve has flattened out from normal. It's supposed to be a forward lordosis, and now his is straightened out. A little tender in these muscles on the side right here, though. And I bet you that's tender right there, too. And he's got some trigger points in his trapezius, levator scapula, and rhomboids right here. Now I'm going to evaluate his neck, palpating his neck. He's got C3, 4, and 5 all misaligned on the right side here. His body right. Now I'm going to have you lock your leg straight right here, Elvin, and lift it straight. Just your right leg only off the table. Nope, straight. Lift the whole leg up. Okay, now let down. Do the same thing on the left. Okay, there. That's pretty even, but is it harder to do this side for you than this side? Could you feel any difference?
I felt like the left
left went up higher.
Yeah, the left did go up a little bit higher, but not significantly. So he doesn't have a big sacral deviation. I think most of his problems actually coming from the ankle itself and the sacroiliac joint, not just the sacrum. And he may have a little lumbar radiculopathy out of the L5-S1, last two vertebrae in the lumbar spine, and nerves coming out between the L5 and the sacrum here is the S1 nerve. That's a little tender right there, though. Okay, so you ready to feel better? All right, so now we're going to adjust his sacroiliac joints first. And we're doing those bilaterally on the X, Y, and Z axes. Sacrum in the middle. And then the left sacroiliac joint. Like that. Now I'm just going to get the right one because it's internally rotated a little bit. So we're going to push it back around externally. And we're going to do a straight Z angle or axis, line of drive on L5, L4, and L3. And you notice the higher I get up in the lumbar spine, the more my angle on my arm changes. Let me get all the way up to L1 right there. And just take a nice deep breath. Let all your air out and just relax. Putting just some light pressure in here and adjusting his thoracic spine. Just breathe normal. I'll catch you. Perfect. Yep. Now I want you to just let this all relax again. Yeah, his upper thoracics are locked up quite a bit. There we go. And these lower ones, right where it transitions to the lumbar spine, those move really well. And we come back down here to the feet, and now they're even, and it gets short. So we still got an issue going on in his right sacroiliac joint. And I'm going to get L5 here again. Even down here now, and it's still getting short there. I think one of the reasons it's getting short here is because he's got a shortening of these muscles. That's pretty tender right there too, isn't it? Yep. This is his gastrocnemius muscle, and it's got knots in it, trigger points. And then on the inside, the soleus muscle, part of the calf, but different than the gastrocnemius. Yeah, this one over here on the right's actually pretty tight too, and that's just from compensation walking. When you're walking around with one leg shorter than the other one, the body's always got to compensate. And I'm going to turn him on his back to check his knee integrity, but let's turn you on your back now, Alvin. Okay. Now, there you go. Lay your head right in my hands here. There you go. That's it. Perfect. Excellent adjustment. But look down at his feet again. You can see that that right ankle is still very swollen. So we're giving him home instructions of crushed ice in a freezer baggie for 20 minutes right on the skin here, as well as some home exercises. Okay, push. That was actually stronger. Pull. That was a little better. Turn in. That was a little better. Turn out. That was also a little bit better. Flip push. That was a lot better. Pull. That was a little better. Okay, same thing. Push. Pull. Yeah, inside and outside. This one is definitely still stronger. Push and pull. Oops, pull. There you go. So we're going to be working and focusing directly on the ankle joint, the tarsals and metatarsals, the knees on both sides, which I evaluate. Okay, relax your knee here. Just let it go. He's got a lot of lateral play there. There we go. Just adjusted his left knee. I bet you felt that all the way up in your pelvis too. Okay, now just let this one go. See, that's a little slack in this one too. Okay, just let this all relax here. Don't tighten it. There we go, better. Excellent. Okay, now let's have you sit up sideways and face towards your knee. Bring your legs over like this. There you go. Okay, now just look straight ahead for me. we adjust the entire spine and all extremities so that we are getting the entire pathway of every one of his peripheral nerves. Make sure he has no interference anywhere along the pathway of the nerves coming out of his spine to the other parts of the body that are being supplied by those nerves. Okay. There we go. Excellent. Very good. Okay, let's come over here in front of the mirror. And as most of you YouTube subscribers and people that watch us all the time, you'll know that we always finish the adjustment up with this neuromuscular re-education device, high velocity instrument. Okay, flex your head forward and backwards again. Back all the way, remember what it feels like, non-neutral. Okay, now see how he's got a way forward head posture. Shoulders are rounding. So here's his home exercise, which is a mirror image. Lift these up. Now pull them back like this. Flare your hands way back here. Now I'm going to have, just let your neck go in my hand. I'm just going to put it in position. Now I'm going to come straight back in the Z-axis, and we're going to translate to the right. You can open your eyes and look in the mirror. Lift that chin up a little bit. There you go. We're going to tap that atlas on the right there. Okay. Can you stand up, okay? There you go. And then we hit it on the left right there. Now, let's have you flex your head forward and backwards again. This should feel easier and smoother, by the way. And then back up to normal. Much better. He's still got a little bit of the forward posture, but did that feel easier to you?
Yes.
Yes, and now his shoulders are level as before. The left shoulder was a lot higher. Very good. Okay, he's even in the middle and the pelvis. This is your Houston chiropractor. We'll see you next time.